Welcome to this introduction to the Comprehensive Class Member Transition Program and the Colbert-Williams Consent Decrees, provided by the UIC College of Nursing. This training will help learners understand the origin of Illinois Olmstead Consent Decrees, describe eligibility for the decrees, and answer frequently asked questions about the decrees. Colbert and Williams are two of the three consent decrees in Illinois that are considered Olmstead decrees. On June 22, 1999, the U.S. Supreme Court ruled that the Americans with Disabilities Act, or ADA, requires public agencies to provide services in the most integrated setting appropriate to the needs of qualified individuals with disabilities. In this decision, the court held that people with disabilities have a qualified right to receive state-funded supports and services in the community rather than in institutions when a three-part test is met. 1. The person's treatment professionals determine that community supports are appropriate. 2. The person does not object to living in the community. And 3. The provision of services in the community is a reasonable accommodation when balanced with other similarly situated individuals with disabilities. In Illinois, there are 3 Olmstead-related consent decrees, each serving a defined population. The Comprehensive Class Member Transition Program involves 2 of them, Williams and Colbert. The third decree, Liggis, applies to individuals with developmental disabilities. More information on the Liggis consent decree is available from the Department of Human Services. In 2007, the state of Illinois was sued in federal court. The plaintiffs argued that the state was in violation of Title II of the ADA, Section 504 of the Rehabilitation Act, and the Social Security Act by segregating and institutionalizing people with physical and psychiatric disabilities in Cook County nursing homes, and failing to provide opportunities for those individuals to live in integrated community settings. In agreeing to a consent decree, the state did not admit to violations, but agreed to provide necessary supports and services in order to allow eligible class members to live in integrated community settings. There are approximately 20,000 individuals who are considered part of the Colbert class. This class size is estimated based on the census of Cook County nursing facility residents who use Medicaid benefits. The class is defined as all Medicaid-eligible adults who are being or may in the future be unnecessarily confined to nursing facilities in Cook County, and who, with appropriate supports and services, may be able to live in a community-based setting. The Williams lawsuit was initially filed in 2005 and argued that the state of Illinois was in violation of Title II of the Americans with Disabilities Act and Section 504 of the Rehabilitation Act by needlessly segregating class members in specialized mental health rehabilitation facilities, SMRFs, which were formerly known as Institutes for Mental Disease, or IMDs. The state denied liability and violations of federal laws, but agreed to enter a consent decree in 2010. This consent decree states, when clinically appropriate, all persons with serious mental illness living in SMRFs in Illinois have the right to choose to live in community-based settings, and that the state has an obligation to expand the community-based service system to support the needs of those individuals. This aims to provide services to individuals in the least restrictive and most integrated setting as possible. There are approximately 4,500 Illinois residents who comprise the Williams class. These are Medicaid-eligible adults with mental illness who live in 23 SMRFs in Illinois and with appropriate supports and services may be able to live in an integrated community setting. What is the Comprehensive Class Member Transition Program? The Illinois Department of Human Services issued a request for applications in October 2019, seeking providers for a pilot program. While the Colbert and Williams consent decrees target different populations, both decrees require the state to evaluate individuals currently residing in institutions, with the end goal of transitioning them to the least restrictive community-based setting, appropriate to the individual's needs. The pilot program, launched in early 2020, is designed to achieve compliance with the requirements of both consent decrees. The program was competitively bid through the NOFO process in the spring of 2022 to continue the CCMTP and update processes for FY23. The vision for the Comprehensive Class Member Transition Program is a person-centered, seamless experience throughout the transition process, from initial outreach to evaluation to finding housing and successfully transitioning, and through the post-transition community services. The program seeks to minimize the fragmentation in the class member experience and increase sustained transitions to the community. Members of the Colbert and Williams classes are linked with care management agencies called primes. These are agencies who have experience working with people who are elderly, people with disabilities, or people living with mental illness. Some prime agencies work with other agencies to facilitate some of the comprehensive program services, but prime agencies are responsible for ensuring that the services are provided effectively. Individuals are connected with comprehensive program services through the prime agency assigned to their nursing facility or SMRF. The class member, their family or friends, other advocates, or facility staff can all make these referrals. Information on the facilities assigned to each prime, as well as contact information for the prime agency, is available from IDHS or on the UIC College of Nursing Colbert-Williams training website. In the comprehensive program, the transition process has several phases. First, outreach, next, assessment and service planning, followed by transition and community management. Class members receive transition services to help them move into the community, followed by services, supports, and follow-up. We will now look at each of these areas in more detail. Prime agencies are responsible for conducting outreach at their assigned nursing facilities and SMRFs. For newly admitted class members, the initial outreach attempt must be made between 60 and 70 days after the class member is admitted to a nursing facility or SMRF. Outreach workers meet with class members individually or in groups to provide education about the services available through the comprehensive program and to answer questions. They also provide education and information to facility staff, as well as class members' guardians and families. Private agencies are responsible for outreaching all eligible class members at their assigned facilities at least once per year. Outreach workers help motivate class members towards transition. If the class member is identified as potentially meeting exclusionary criteria, they may be referred for an exclusionary review. Otherwise, the class member proceeds to the assessment and service planning process. Care managers are qualified professionals who complete the assessment and corresponding service plans to identify and address a class member's preference, strengths, needs, and abilities. This process explores a member's physical and behavioral health, functional abilities and limitations, housing preferences, and previous independent living experience. Class members who choose not to complete an assessment or who decline during the transition process will receive annual follow-up and can request an assessment sooner if they choose. The service plan is developed by the care manager in collaboration with the class member, their family, facility staff, and other pertinent providers. The comprehensive service plan is to be finalized within 45 days of assessment initiation and updated at least every 180 days through 18 months in the community. In addition, a transition service plan must be finalized within 30 to 60 days preceding a move. Class members have access to a variety of housing options depending on their needs and preferences. These options include apartments with private landlords, senior buildings, supportive living programs, family homes, or supervised residential programs, also known as group homes. The Department of Human Services works with other state agencies to locate and develop different types of housing to meet members' needs. The care management agency working with the class member will provide monitoring and support for at least a year and a half after the member moves to the community. This support is provided in person and by phone. The care manager is responsible for coordinating other necessary supports based on the individual's needs. These could include services from a community mental health agency, home and community-based services through a waiver program, home health care, durable medical equipment like wheelchairs or adaptive devices, and home modifications like grab bars or ramps. In addition to these services, class members also have access to transition funds. These funds are set aside to pay for the things that are needed to start a home. These include security deposits and application fees, furniture, and other needed items. Class members can also use bridge subsidies to help pay rent. These rental subsidies limit a member's rent responsibility to 30% of their income, with the subsidy paying the remainder of the rent to the landlord. This subsidy helps bridge the gap between leaving the facility and obtaining a permanent rental subsidy or housing voucher. In addition to the requirements set forth in the Colbert-Williams consent decrees, the comprehensive program operates with several policies and procedures and requires the use of specific clinical documents and forms. The policies and procedures can generally be divided up into phases of the transition process. Some policies and procedures affect the entire comprehensive program process. These include how information should be submitted into the Colbert-Williams Program Management online web app, and how select documents must be submitted to UIC College of Nursing and to the Illinois Department of Human Services, and how signatures can be recorded for these documents. These are addressed in Orientation Module T0.1, Document Submission and Signatures. In the outreach phase, several documents are completed, including the informed consent and outreach outcome, and the program fact sheet and frequently asked questions. These are covered in Orientation Module T1.1 Informed Consent and T1.2 Outreach. The assessment phase is complex. There are several fields that must be completed in the Colbert-Williams Program Management online web app in this phase, and multiple policies that apply to the assessment process. Orientation Module T2.1 reviews the assessment process itself, and Module T2.2 discusses how to handle class members who decline services or who want to appeal a decision. Once a class member is proceeding towards transition and service planning tasks must be completed. These documents must be completed at different points during the pre-transition phase and are governed by several policies. CAST, or Complexities Affecting Seamless Transition, is a process for the clinical review of cases where a class member may no longer be appropriate for transition at this time. Case reviews are a pre-transition clinical review of class members conducted by UIC College of Nursing and DHS. Orientation Module T3.1 provides detailed instruction on service planning, and T3.2 addresses other pre-transition processes. There are several documents associated with housing. Some of these are linked with bridge subsidy. Some are information for landlords, and some are required for all members. Comprehensive program policies address the housing phase overall, the process for connecting class members with the statewide referral network of housing options, and the bridge subsidy itself. Orientation material for these processes are available on the UIC College of Nursing website. After a class member moves to the community, prime agencies are responsible for 18 months of monitoring. Changes to the class member status or clinically significant events called reportable incidents must be reported to UIC College of Nursing and DHS. Reportable incidents undergo clinical review, and incidents involving the death of a member are reviewed through a special process. All of these post-transition processes are addressed in Orientation Module T5.1. There are several processes that do not fit neatly into other categories. These include addressing concerns with Medicaid, nursing facilities, and SMRFs, working with class members who do not have income, obtaining neuropsychological testing, and connecting class members to services from the UIC Assistive Technology Unit. These are reviewed in Orientation Module T6.1. The comprehensive program offers staff and agencies several options for training and professional development. The UIC College of Nursing Colbert-Williams training website serves as a repository for all of the educational and training resources for comprehensive program providers. The site also contains up-to-date copies of all of the comprehensive program policies, procedures, and forms. UIC College of Nursing provides regular trainings on a variety of topics related to care management and chronic condition management. These include process-oriented trainings as well as condition-specific information. These are primarily provided in webinar format at this time, although in-person training may be available to prime agencies as needed. These webinars are recorded and posted for future reference. CEUs are offered for many of these webinars, and additional information on this is available on the Colbert-Williams training website. The website also contains educational resources, including links to other sources of information and reference sheets or handouts that can be provided to staff or class members. To ensure uniformity across prime agencies and to provide regular updates on any policy changes, IDHS requires that all prime agency staff funded by the Comprehensive Program Grant complete required training modules within 60 days of their initial hire, as well as once per fiscal year thereafter. These modules and a description of training requirements and opportunities are outlined in Policy P0.09, Training Requirements and Opportunities. Current versions of all comprehensive program policies and forms, as well as educational resources, can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk email listed on that website. Thank you for your attention and efforts to ensure safe and successful member transitions.